and invite Professor João Arriscado Nunes. He's Associate Professor of the Economy Faculty of University of Coimbra in Portugal. He is a permanent investigator in the Center of Social Studies. It's in the Center of Social Studies, especially with the laboratory associated to the Economy Faculty at the University of Coimbra, Social Theory and Cultural. He organized some books, of which we can mention In Theater of Galileo, Semi-Periphery System, Reinventing Democracy, and Impure Objects, Experiences and Studies on Science. Thank you very much for your presentation, and I would like to thank this invitation, especially by Professor William Weissman, who invited us. And I would like to present here what are some of the reflections of the results of one or two projects and initiatives about the public involvement in the Department of Technologies, of Nanotechnologies. The new nanotechnologies are part of this new scenario, and it has many characteristics that makes them different from other technologies, as what is the debate and the public discussion of technologies that consist in the construction of scenarios in the world that is transformed by these technologies, and also what we call the multiplication. They are retractors of financial funding, not because not by the results that they have had, but that they promise to have with this funding. For these two characteristics, what is the difficulty that is created, and it is dynamic, and it transforms between what already exists, like in some cases there are objects and products. Many of them already exist, but that aren't known yet by the great part of the people, majority of people, and that are in contact or are affected by them. And so the distinction between what exists and what is feasible, what exists and is possible, with the technologies in the near future, what is what we can foresee in 10, 20 years, what will be achieved based on these technologies, and to see, we have to see seriously what these technologies are. The definition of what is science fiction is altered a lot through the time. For this, there was created a difficulty to have a public debate about these technologies, with the implications in the daily life of the people and of society, and that aren't so visible, like some medical innovations that are part quickly of the daily routine, that transform themselves in consumers' products with sometimes negative or positive consequences. Some kinds of biotechnologies like transgenic foods and products that were sold in supermarkets, and this gave origin to some kinds of seeds in agriculture that and also some animals that were created in laboratory to see how they developed with this kind of feeding. So some of these technologies that are many times innovative, and they bring some expectations and also problems, but they are tangible, and their impacts can many times be clearly discussed. In the case of the nanotechnologies, there is an initial problem that all those who try to involve public engagement we're talking also about actions that deliberate over some definitions of priorities, like the technological development, or also the regulation of these technologies. So what I'd like to talk about is the result. We have an initiative that is linked with this project that tried to deal with this question. It's the Deepen. It was a project that was financed by the European Commission for institutions, and also in Coimbra, in which Coimbra is one of them, where I live. This project has two objectives. One of making a research, the forms in which different kinds of actors who are involved with the production and research of the new technologies and what they are, and define what they are, and the aspects that have to be of public concerns, and the use that would also try to discuss, this group would also discuss the new kind of specialists, people who were not involved but in the development of the production, what they, in fact, how did they relate with nanotechnology, and how they defined their concerns. And also a second phase would be to try to design a spine where a debate could result in the regulatory policies for nanotechnologies. And to have general guidelines in this theme. The second project was called Nanomed Roundtable. It's a group of specialists in various areas, and who tried to make a list of what were the principal initiatives linked to nanotechnology in the medicine field, and also wanted to monitorize the implications, the technological initiatives, even the controversy ones, but also what is called the ethical implications referring to nanotechnologies. The reports of these projects have been reported. I won't talk more about this. We'll see what we did relating with the public involvement. This public was made in England and Portugal by two different teams that talked to each other, and they used very similar technologies in their designs. What we tried to do was exactly those who were not specialists in nanotechnology, or those who didn't know what it was, and in some cases hadn't even heard of the word, and how they wanted to see how they could organize a public debate and to develop research and development. It might seem strange. How can you put together people who don't even know what they know about this? How can they contribute with this? And this is what we wanted to know, if it was possible or not to do this. So there was an inventory set of the themes that we thought that were the most important themes. All the uncertainties, for example, in research and the production of science and technologies, all of them bring with them these uncertainties that are sometimes not identified. And this kind of debate also should call the attention to that. And I would also talk about the risks and benefits, what would be the risks and benefits of the technologies, and then after the effects on health, environment, and daily life. So these were the expectancies of the themes that would come when we started making this empirical research with real person in some spaces for debate. We carried out quickly 4 groups of discussion with non-specialists in Portugal and in England, and afterwards we made another initiative, which I'll explain later on, that would be the construction of scenarios that were transformed in a representation and a kind of performance that would be criticized by one group and by another group. And afterwards we made a deliberative forum that would include scientists and people who were linked to nanotechnological industries, and people who were in the education and scientific promotion and education. So when we began this project, the way that we had to, in introducing the theme for people who didn't know it, consisted in simply prepare material in which people can access in the media. So all material from newspapers that covered the different themes. And what we did was we explored these people who read this material, and we asked them to start to discuss in the debate and what did they think would be their concerns and expectancies with these technologies that were in the journals that they read. So these people, they quickly knew about the theme, and they conducted it with reactions that we didn't foreseen. There was someone who said, you have to discuss these points and others, the relation of risks and benefits, impacts of health and environment, and people started discussing other things that were quite different from of those that we had foreseen. a theme was of the redefinition of the characteristics of person and the enhancement, the human enhancement, something that would appear. So what this became a more ample discussion, because the possibilities of the reconfiguration of the peoples in their lives, and also with able to achieve initially. Some of us knew this could happen, but there were some readers in our that thought that this was interesting. Another theme was the possibility of reconfiguration of the material of the world through its manipulation. And once again, they brought to the discussion, they wanted to know, why do we have to do this? Why do we need this? Do we really need this? How are we going to do this? How are we going to make these decisions? So I remember that there was a part of an article in which a scientist said that one day we will be able to have paint for cars that will be able to change every day. And the question of those people would say, why do we need this? So there was this kind of interrogation mark that interfered with what we called this optimism with no frontiers that was talked about before. So there was a big concern of the capacity of destruction with the use of technology, like the military uses. This was a concern that appeared many times. The issue of regulation and no so much, but orientated for something else, to know who is going to have the legitimacy to make this regulation, who is going to participate of this regulation, and also the insistence in the choices and orientations. And then there was a theme that was crucial and central, that was of the inequalities in the access of the benefits of the nanotechnologies and in the distribution of the risks and that were associated to them. So these disequalities were internal, but also north and south, that they were brought, also the inequalities of north and south. This set of initiatives was trying to identify what Michael Fisher calls the new ethical plateaus, and he says that there are horizons of ethical problems that are placed by the intersection of various technologies and the institutional formatations and their developments through the markets and other mechanisms. And they had to constitute formats for this ethical plateaus. With this content of these discussions, the other work that we did, there was one that had to do with the public involvement in a public that wasn't specialized in the debates about technologies. And one was the they wanted to know if we always, when you enter a debate, you are always in the middle of the way, and this is what brings the concern to open the debate. But the idea was that we shouldn't discuss the technologies after they have been shown to society and have already produced effects that could eventually be negative or even positive. What one wants to discuss is the implications of technologies they have to be discussed when you can still make decisions and still see the orientations of research and development. The second interesting aspect, a strong word that always appeared in this project was the word ethics. But they saw quickly that this ethics meant a place of discourse of the technological, ethical, and it was also in the description that didn't exclude any aspect, and they tried to articulate them. And what they said also was what counts as an ethical problem. Who was involved in this project? They depended on the position in which they occupied in the process of their regulation. And it was important to see, as when they said that technology brought ethical problems, they wanted to know to whom they brought these ethical problems. Another thing that we wanted that was interesting, the fact that we verified that this didn't happen only in this project, but we tried to study this question in the participations and the health councils that are the effects of the food technologies that haven't yet appeared that could say we are especially affected by these technologies. For example, the agricultures, the farmers who can be affected by the people with illnesses with disease that can be affected with the medical technology, the communities that can be affected by a determined kind of object or technology that can generate problems in health. Like we saw with lead, these affected groups were not recognizable when we began. So what we tried to do was to identify as a first step a group that could be the first line of concerned citizens that could give place to this. And the consequence is that the involvement of the citizens, they themselves contributed to give names to certain groups who will act as, who will assume this awareness. This talks about various problems, that political problems that are interesting to be seen, not here today. So when these two public involvement, the first group was the idea to create spaces of processes that was based on the capacity of people wanted to talk about their own experiences with other situations in which they had to deal with technologies. And we used as a first model to put place in this project a focus group, and we transformed them later after a reading that we did in what we called cultural circles, and let them speak first, and after make a record of what they said, using some material so that people could participate in what they said in a compromising situation with the team, and develop positions that would let them deliberate over the theme. And we used also a variant of the forum theater, and we included also building these scenarios, and through this process it was possible to help people build scenarios that with alternative knowledge, to know about this knowledge. With these groups were made by people who were not specialists. The second kind of spaces was the deliberative forums that should discuss the nanotechnologies and see and have as a result a document or position that was a public act that would be presented to the European Commission and also to the Science Ministry in Portugal. And this included also the scientists. What was interesting was that in the two forums, what was important was that the meeting and the involvement with health and medicine. Two examples of what were these processes. In the one first group, we invited members of association of patients, and we wanted to discuss the implications of nanotechnologies, and what they discussed were the nanotechnologies in health. And one was a representative of Diabetic Society, and they asked, how do nanotechnologies, how are they different, what makes them different from one system of delivery of insulin or distribution of insulin, and some that exist are quite sophisticated by those that will be introduced through nanotechnology. So, and what are the problems that could appear with this difference? And another interesting thing is the limits of intervention on humans in the name of health. The idea of prolonging life. So maybe the life could be prolonged until a limit that today is not thinkable. And they asked, do we really want life to be prolonged until this point? What are we going to do with such a long life, for example? In the case of the citizens' forums, where the scientists were basically involved in the production of materials or in the medical nanotechnologies through this drug delivery system. And what was important is that was the centralization of the regulation. This was the big concern. This says, okay, we have new technologies with great potential, but they have to be regulated. And to regulate them, do we really need specific laws for technology, or can we use what we already have? So they used what was a narrative, a history of the regulation of medicine to defend, for example, that the processes of medication could continue to be used with the benefits that, so that you could see the different specific differences that nanotechnology would bring. So we verified that in these discussions there was always a tentative to bring a relationship between experience and knowledge, and this there was a they would think about the novelty. So there was a strong notion with this experience. This became quite clear and made us think this is an extension, as Michael Fisher said, that the new ethical plateaus are plateaus of experience and also plateaus of concerns. They are also of crossing different kinds of concerns and also of positions that manifest the necessity and the wish to know which are the eventual risks and benefits and implications that can come with the new technologies. And I'd like to thank here all who participated with this project. They were financed by Deepen, and who wants to access, there is our site of social studies where you can access this. Thank you very much.